My top PT tip for gauging your fitness level is very, very simple. Take a resting, first thing in the morning pulse. Especially if you're starting an exercise regime, this is the best baseline you will get for improvement down the road. First thing in the morning, give yourself a minute to open your eyes. What I normally do is I use the stopwatch on my cell phone, and I go for either the radial or the carotid artery pulse. Personally, I find it easier to teach the radial pulse. I think people get confused with their carotid artery, and there's always the danger that you might press too hard and occlude the artery. It doesn't happen often, but you don't want to go there. So for the radial pulse, probably the best way to do it is to take your forefinger and your middle finger and find this outside bone, your radius, and come right off that bone without putting too much pressure on that little artery, and give yourself a moment or two to feel that pulsation. That is your radial pulse. So what you will do ideally is to, with your stopwatch, count those beats for a full 60 seconds to get the per minute rate. Once you get better at this, and of course you'd never take your pulse with your hand up in the air. This would be done with the arm at your side, on the bed, probably on the pillow next to you. Once you get better at judging this rate, you can then take it for 20 seconds and use some math. 20 times 3 will get you to that 60 number. I don't advise doing it for 10 seconds because it's more of an estimate at that point. So take this pulse for your 60 seconds and document it either on your phone, someplace on your laptop, or if you have a runner's journal, put it in there. Take your baseline before you begin your activity. You may be shocked to see the difference in a week, 2 weeks, 3 weeks time. And the reason for that is because as you begin to tax your cardiovascular system, your heart muscle gets perhaps a bit larger, more muscular, and more efficient. So it takes far fewer beats to move that blood around your body once you're an athlete, once you've exercised. So expect normal for a woman is 75 beats per minute, and that is definitely just an average. That number changes with your age, with the time of the month. We discuss the fitness level, if you're fighting off an illness, if you're on medication, if you're dehydrated, but in general, you're going to take an overview of these numbers, so it's less important. But if you are starting at, let's say, a 75 number for a female, and you see that number start to drop, that is, to me, the single best motivator for getting back out there, at least your 3 times a week, and working that cardiovascular system. And once you get the hang of it, you don't need to take this resting pulse every day. Once you start to see those numbers change, you can take it once a week, you could take it even once a month. Once you've really pushed yourself, you're not going to see those same dramatic changes as you would in the beginning. But this is my top PT tip to motivate beginners. Take that resting pulse. Happy, healthy trails. Bye-bye.